Do you suffer with gas, bloating, and belching? Is it a chronic issue? Have you had it for a while? And you've seen your doctor and you were diagnosed with irritable bowel syndrome, which is also called IBS, or gastritis or dyspepsia. Well, the reason I use the old air quotes there after the diagnoses is that those really aren't diagnoses at all. So diagnosis provides a name or a label for what's causing your issues. And yes, technically those are diagnoses. They're listed in the diagnosis manual that us providers use. But they're really not diagnoses. More on that in a second. So let's look at the article here. Gas, bloating, and belching, approach to evaluation and management. So we got the American Family Physician, which is the online journal or publication put out by the American Academy of Family Physicians. So this is what your doctor is reading on a regular basis, your family doctor. So they read this article and they kind of take it at face value. Then they see someone like yourself that has gas, bloating, and belching and a number of other digestive complaints. And because they've read this article, they just decide to relabel it with a kind of a fancy term for what symptoms you have, what you put on your questionnaire, what you talk to them about in the few minutes that you had face-to-face with them. And they send you on your way with some sort of medication recommendation to help manage the symptoms. Not really a cure, because you don't really have a diagnosis yet. You don't know what the cause of those symptoms are. So let's read down here further. So if we look at the highlights section here, functional dyspepsia, irritable bowel syndrome, and chronic idiopathic constipation are the most common causes of these disorders. So I don't know if you realize how kind of funny this sentence is, or maybe awkward, or in a way appalling. And I don't know what to call it. So let's talk about that a little bit, and I'll tell you why I'm kind of left speechless here. So functional dyspepsia. So dyspepsia just means upset stomach. Functional means there's no structural problems. So there's no ulcer, nothing like that. So okay, we got that. We got non-structural related, so we don't have any ulcers, bleeds, nothing like that. Upset stomach. So does that sound like a cause of anything? Or does that sound like a symptom or the end result of something? I think you realize it's the latter. It's not a cause. Irritable bowel syndrome. So there, you may not realize this, but that's still just talking about your symptoms. A syndrome is a constellation of symptoms. So you're going to your doctor, you're saying, I have constipation, I have stomach pain, get diarrhea occasionally, I have some gas and bloating, and they say you have irritable bowel syndrome. So they're just taking that symptoms, that group of symptoms that you just talked about, and putting a label on it, and then spitting that back out at you. Irritable bowel syndrome. So again, not a cause. And chronic idiopathic constipation, that's kind of the oddest one of all, because idiopathic, by definition, means no known cause. So chronic, meaning you've had a long time, idiopathic, no known cause, constipation, constipated, are the most common causes of these disorders. I mean, it's ridiculous. Those are not causes at all. I think anyone could see that, even without a medical background. So then they go in later in the article and they have these charts here, and they talk about some different situations. And at the top here we have what we just talked about: functional dyspepsia, irritable bowel syndrome, chronic idiopathic constipation can be diagnosed using symptom-based clinical criteria, meaning you fill out a survey or questionnaire, you mark certain symptoms down, the doctors question you about the history of those symptoms, how long you've had them, what else are you feeling. They're reasonably sure that you don't have any bleeds or major infections like a food poisoning or stomach flu type thing. You don't have cancer. And so they rule that stuff out. Maybe they do a test like a scope or a scan or something like that to rule that stuff out. But then they just use symptom-based criteria, so the questionnaires and just talking to you to come up with a diagnosis. And again, as we talked about, those diagnoses aren't really a diagnosis. It's not a cause. The other interesting thing here to point out is this evidence rating C. So there's different levels of evidence, meaning that you have solid evidence through research trials that are designed well, that have plenty of participants, So that would be a real good rating. The C rating is just basically consensus. So they get a group of docs and scientists in a room, and they talk about the issue, and they basically come up with this consensus. All right, so you think you go to a doctor, you're getting these diagnoses, which, again, in this highlighted area, they throw those names on there. So irritable bowel syndrome is a very common one. That's usually the most common one that we hear of people being diagnosed with. And then what do you do from there? So we already know it's not a cause. It's just a grouping of symptoms. So they still don't know what your cause is. So any recommendation after that is basically going to be a guess. Because they don't know the cause, so what type of intervention can they apply to an unknown cause? Well, there's really no solution at that point. It's just managing your symptoms, because all they are doing is identifying your symptoms. They're not identifying your cause. So then any intervention, usually medication, and you've probably been recommended these before if you've had this for any length of time, whether it's Malox or Miralax or fiber supplements or some other sort of medication, maybe an acid reflux medication if you have stomach pain and belching and problems there, burning in the esophagus, proton pump inhibitors, so acid reducers, which then have some side effects that go along with that. So you're managing symptoms. You're not fixing the problem because they don't know the problem. They don't do the right tests. So let's fast forward into the future to where this problem is figured out. And it's actually today. It's actually probably 10 years ago, if we're being honest here. And we do have tests. We do have a mechanism. We do know the cause. And I've run this test on hundreds of patients, and we've helped them overcome their symptoms, not just manage them, overcome them. So here's a patient here. You run this test and you check for some of these bacteria, and we look for a wide range of bacteria that could be causing something called dysbiosis or small intestinal bacterial overgrowth. And all these issues are basically an overgrowth of bad gut bugs that shouldn't be there, that then can lead to many of the symptoms that people with digestive disorders have. So here we have a number. Here's a patient, blocked out the name here, but here's an actual patient result. And you can see they have a number of different bacteria present, with the Pseudomonas being over the lab values here and flagged as being high. And this patient also had this thing here under the worms, Ancylostoma duodenale, also known as hookworms. Now these things are visible. These things are about, I'd say, maybe ½ inch long. And people are grossed out because we start killing these things off. We start giving the stuff that kills these things off, and it shows up in their stool like hundreds of specks of rice, basically. And really weirds people out. But, I mean, when you have these things living in your gut, undetected, they could create major problems. So whether it's worms, there's parasites, there's various types of parasites. We have viruses, fungus, yeast, bacteria. We don't have to just settle for some generic label of your symptoms, like irritable bowel syndrome. I mean, it's in the name, irritable bowel. We know it's irritable. You're having problems. You're having pain. You're having bloating, constipation, diarrhea. Yes, it's irritable. We know that. So when you get diagnosed with that, what is that telling us? Again, it's not telling us anything at all. Well, how can this happen? Why does this happen? Why don't doctors do tests like this? Glad you asked, because we have a presentation that covers all of this stuff and more. We talk about why doctors aren't ordering the correct tests. We talk about why doctors are just labeling it as a syndrome and managing your symptoms and not getting to the root problems. We talk about treatments that you may be doing on your own, whether it's been recommended by a doctor, or maybe you go on a message board or a Facebook group, look for recommendations from others, things like probiotics, fiber supplements, maybe eating yogurt. We talk about why those might be the exact wrong thing for you, depending upon your situation. And we talk about how testing can help identify the true root cause, instead of just guessing. Don't guess, test, is our mantra here. Because then you can find the actual cause, the actual root problem, and get a diagnosis, instead of just getting a generic label for your symptoms, which you know you already have. So click above or below this video, Register for the presentation, completely free, and you'll learn about all this stuff. And if you have these symptoms, if you have these problems, I mean, you know what it's like to have to run to the bathroom every few minutes in the morning, to have the bathrooms mapped out on your way to work, or if you go on vacation, having the anxiety of not knowing when you might reach the next bathroom, not being able to hike with your friends. Because you go out for a 3-mile hike for a couple hours, there's no bathrooms out there. Or maybe you suffered the isolation of having constipation. So again, click above, below. Let's get this figured out. Watch the presentation, and I think you'll definitely want to see this information. So again, above, below. See you on the other side.